What are some of the misinformation that you see?
The types of questions that we get in our outreach activities are some of the basic ones that you might hear that range from, does it have an impact on fertility? What are side effects? I have allergies, and then, you have some other ones that are, I think, misinformation. I heard this is going to change my genetic material. We try to explain that mRNA vaccines don't change your genetic material. So I think at the extreme, you hear some of the conspiracies, if you will, about it. But more commonly, you just hear basic questions that people just, want to get answered themselves. A big one is, I have allergies. I'm worried. What should I do? But again, they kind of run the gamut. But I'd say more common questions and kind of, things that we would consider a little bit less common or more outlandish, to be honest. But either way, we're there with curiosity, with empathy and respect, and giving people the information they need.
Do you think that vaccine hesitancy is just something that people sort of default to rather than realizing that there are problems with access to? And I don't mean that vaccine hesitancy isn't a real thing when I'm asking you this.
I think what we need to understand when we look at vaccination rates and we see that communities of color are vaccinated at lower rates than their white counterparts is that the reason for that is multifactorial, and the only way to address it is multifactorial. By that, I mean, we cannot default to say it is just because they are hesitant or don't have confidence in the vaccine. If in fact, we don't have supply in the community that is easily accessible, that people can easily schedule into or walk into in ways that they can understand. So it really is a multi-legged stool, if you will, that if, without any one part, the stool tips over. So you could have people who are very confident and who want it. And if it's not available, you're going to see differences. Or you could have a lot of vaccine available, but if you don't address hesitancy, you're not going to see the numbers you want. So you really need to think about all the different strategies. But I think defaulting to say, oh, it's just about hesitancy, when in fact you haven't done the other things that are necessary to make it available, accessible, easy to get, I think that's a big mistake, and that's just factually an inaccurate, I think, assessment of why we see these differences in vaccination rates in communities of color.
What are some of the obstacles that you've encountered in your work, and what have you done to sort of respond to those?
I think I feel fortunate in that we haven't faced a lot of obstacles in this area as it relates to our strategies to outreach to communities and address their lack of confidence. And I think we knew that that's one thing we could control, even if we couldn't control supply, or even if it would take a while to set up operations in community sites. We knew that the one thing we can control, the one asset we had, was ourselves, being able to go out there as caregivers of color and communicate with people. So we leverage that asset very quickly. So in that area, I think the obstacles have been minimal. I think that's been smooth sailing, and it's an easy asset to leverage. I think some of the other obstacles have been the issue of just getting vaccine in community, making it easy. Those have been things that take a lot of work and a lot of advocacy, and we've been doing that. So I think that's all those obstacles are slowly becoming less relevant.
Are there future things that Mass General is looking to do with regards to outreach?
Yeah, Mass General Brigham, I think, is right now looking to do just more general community vaccination, so not just our patients. So we are in discussions with other healthcare system partners and cities and towns to think about ways in which we could do things together to just help communities, whether it be mobile, pop-up, or at specific sites, just coming together. We all realize as systems that these types of things shouldn't be things that we compete on, that we should collaborate on. And so we're excited about that. We're going to be exploring mobile, walk-in strategies, these collaborations. So those are all things that are on the horizon, and we're really excited about them.